Hi, I'm Kelly, and I'm going to give my Oral-Mech exam to Rick.
I don't know what the camera is.
So,
You're fine.
I am looking at your posture. You're sitting up nice and tall. You're responsive to the conversation that we are having. I notice that your breathing is relaxed. You don't seem stressed. You're able to breathe through your nose. There are no secretions happening around the mouth. And now I'm going to ask you to hold your breath for 6 seconds for me, whenever you're ready. Good, thank you. And then I'm just going to have you just relax for a couple more breaths and swallow as needed while you're breathing. And I'm going to be looking to see how they align.
You want me to swallow?
Good. All right, so before we get started on doing any different movements, I want to inspect the inside of your mouth. So I'm going to ask you to open your mouth up nice and wide. And I just want to look at your teeth, make sure they're all nice, and your arches, looking at your hard palate, and your soft palate, your tongue. Good. It all looks like it's in good shape. So what I'm going to ask you to do now is to open your mouth and close it nice and wide. Good. And I'm going to put some pressure on your jaw, and I want you to, good. And then I'm going to do the opposite so that your jaw needs to be open, sorry. And then try and close it. Good. Thank you. That was a little hard. Sorry.
Okay.
Then I want you to do lateral movements. Good. And then can you stick your jaw out for me? Protrude it. Good. And then back for relaxed. Excellent. We're going to move on to your lips. Can you purse them and smile? And can you puff out your lips? Good. All right. And I'm going to grab this tongue depressor, and I want you to pinch the depressor between your lips, but not your teeth, and I'm going to tug on it to see that there's good muscle strength there. Good. Thank you. Your lips are good. Now we're going to continue on to your tongue. Can you stick your tongue out for me? Good. And while it's out, can you go side to side? Good. And can you, I'm going to ask you to squish your tongue all the way back like you're saying a g sound. I just want to look. Good. Can you get your tip of your tongue back? I'm going to do that. Good. Good. Thank you. And can you bring your tongue tip to the tip of your teeth? And can you touch the tongue tip on your lips? Good. And touch your bottom lip with your tongue tip and lick your lips. Excellent. And now the last two, I'm going to ask for you to pretend like you're scraping peanut butter off the roof of your mouth with your tongue. So you want, yep. Good, thank you. And then I'm going to rest my hand on your cheek, and I want, yep, stick your tongue against it. Good, and the other side. Good, thank you. All right. For the next part, I'm going to have you say a couple of sounds over for me. So before you start each one, I want you to relax your body, but you're still sitting up so you can take a nice deep breath. But you're going to say puh, repeatedly, puh, 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 as smoothly and evenly as possible for roughly 10 seconds. I'll count for you whenever you're ready.
Puh 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 puh.
Good. And you can relax and take a breath, and then the next one will be tuh. I want you to go tuh 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 for 10 seconds when you're ready.
Tuh 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 tuh.
And then you can stop if you run out of air. That's okay. The next one is ka over and over, ka ka ka, as smoothly and evenly as possible.
Okay. Ka 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 ka.
Good. Thank you. Take a breath and relax. The next one I want you to do, the last one for this set, is pa-ta-ka over. So you go pa-ta-ka, pa-ta-ka, as evenly and smoothly as possible for 10 seconds.
Okay. Pataka, 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 pataka.
Good. Thank you. All right. So next, I'm going to use the tongue depressor to press your tongue down gently. And I want you to say ah, 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 ah several times so that I can see your soft palate moving up and down. Go ahead. So go ahead and open your mouth. Okay. And when you're ready. Good. Thank you. And the next one is that I'm going to walk the tongue depressor slowly back on your tongue to look for that gag reflex. And it's okay if you don't have one. 20% of people don't. So I won't go all the way back. Good. Thank you. All right.
So that's not a very long
I know, yeah, it's
tongue depressor.
A short tongue depressor. So this time I'm going to touch either side of your cheek or tongue, and I want you to raise the hand that matches the side I'm touching. So if I'm touching your left cheek, raise your left hand for me.
Okay.
Okay. I'll try and move out of the way. Whenever you're ready, go ahead and open. Good. Thank you. All right. Now for checking our voice, can you say hold ah for 6 seconds for me and I'll count for you? Good. You can stop there. And this time, I want you to relax, take a deep breath, and I want you to hold ah for until you run out of air, or as long as possible. When you're ready, I'll start counting.
Okay.
Good. Thank you. And can you, you're going to do a vocal raise for me. It'll sound like this. Good. Can you cough for me? And can you clear your throat? Good. And the last thing I'm going to have you do is I'm going to check while you swallow, and I'm going to rest my forefingers along your neck so that I can feel your muscles working for the swallow as it goes. Whenever you're ready. Good. Thank you. And that wraps up our Oral-Mech.